We're good.
Okay, so,
Okay,
roll.
just, please.
Captures, good.
Sound rolls.
Be camera rolling.
Okay, start rolling. Start rolling, good. Okay, all yours.
And take it away.
Well, welcome. Can you tell us your name and a little bit about yourselves?
My name is Daria Cunningham. I'm actually living with carcinoid. I've been diagnosed a few years ago. This is my husband, Emerson Cunningham, and through the course of the journey of my illness, he's actually been my primary caregiver.
Can you tell us a little bit about the onset and the first time you really started experiencing a lot of the symptoms which led to the diagnosis of carcinoid syndrome?
Probably 3 years prior to my diagnosis, I began a lot of symptoms with diarrhea, issues with diarrhea, nausea, vomiting, extreme fatigue. Couldn't quite get a grasp on what was going on. It was chalked up to other issues such as I had problems with fibroids, I had problems with bad back. So I was giving treatments for all of those issues. Beyond that, never really dealt with what was going on with me. I guess the biggest thing was I ended up having to have a hysterectomy, thinking that was going to help with my other major symptom was chronic abdominal pain. So ended up having a surgery, hoping that that would solve that problem, but the nerve blocks, cortisone shots, none of those things were giving me the relief. So I realized that there's something else going on with my body, but couldn't quite get a good handle on what was truly happening with me.
And then what led you to, if you could tell us a little bit about that visit to the doctor with the extreme rectal bleeding, if you want to take us through that point.
Well, in a hurry of trying to get my youngest daughter ready for her first day of school at kindergarten, spent the day running around, knew I wasn't feeling well, but just was trying to push through it, and ended up at home with a bad episode of rectal bleeding. It was profound. Knew I needed to get to the emergency room quickly. Once we got there, again, the doctor's initial reaction was it's no big deal until they actually themselves saw the amount of blood and realized they needed to do a colonoscopy. So it took 2 days to get the bleeding under control to where they felt comfortable going in and doing the colonoscopy, and that's when they found the primary site of my cancer in my large intestines.
And I was really amazed at the fact that we had to convince them to look at her further. That was disappointing, but what we understand now is that that happens often. We have to convince them that it's not just a minor, gastric issue, but a major illness was happening right before their eyes, and they didn't want to diagnose it correctly.
So you're informed that you have this tumor, but they never necessarily said the word cancer. So those 2 weeks, you want to tell us a little bit about those next 2 weeks with the results and such?
Well, after the doctor completed the colonoscopy, he had an odd question to me. He walked in, he says, "Do you pray?" And we thought, "Yeah, we pray." He says, "Well, if you pray, you'll be fine. I found a tumor, but it's okay, don't worry about it. We'll take care of it." And that's how he ended it. So there was a confusion as to what exactly did he just tell me.
And we looked at each other
Did he
was that?
Did he tell me I had something? Or did he tell me I didn't have anything, and we didn't quite know? So it took 2 weeks before we could actually physically get our hands on the pathology report, because every time we'd call and try to get the results, they were like, "Well, we haven't gotten them back yet." But what we found out later was he got the report, didn't know what it meant, sent it to another hospital for a second diagnosis. They didn't quite know what it meant, so they actually ended up sending it to the National Health of Institutes. Can't ever get that right.
Institutes of Health.
National Institutes of Health, thank you. And they actually was able to give them a concrete diagnosis that it was carcinoid. So it took 2 weeks for that process to take place and us to get the pathology report report back with a definite diagnosis of carcinoid cancer.
So before we move on to the treatments and the research that was done, can you just tell us a little bit about everyday life? So we've talked now about a long haul to get to your diagnosis, but what is everyday life like for you?
Well, I had, which was another thing that was part of my diagnosis, was chalked up. I had 2 small children. My kids are 16 months apart. When I originally began having symptoms, they were 2 and 3 years old. I was working full-time with 2 small kids, and of course my husband was working full-time. So we were busy. We were busy with getting them back and forth to daycare, gymnastics, tumbling, all the things that you do as a family, and just always thought the nausea and vomiting was because I wasn't eating a good meal, I didn't have a good proper diet, and so I was being told by the doctors I needed to eat better, I needed to get more rest, and those would help my symptoms. When the symptoms persisted, even after I made those changes, I was given a diagnosis of IBS, and so it was constantly going through different symptoms with it's just this, take care of that, it's just this, take care of that. And every time we made a change, nothing changed different in how I felt. So at one point I actually switched from a job where I went into the office to being home. I took an assignment where I was able to work from home because I spent so much of my day in the bathroom that it just got embarrassing that every 15 minutes to 30 minutes, excuse me, I've got to stop and run to the restroom, till I was able to manage that better working from home. And I actually worked from home for about a year prior to my diagnosis, and trying to figure out what was going on with me because the diarrhea and the vomiting had become just unmanageable for me. I wasn't able to take care of it anymore with the over-the-counter medications, and even with the prescriptions that the doctor was giving me, it was just strong over-the-counter medicine, but it still wasn't helping my symptoms.
But here's what I saw. She dealt with it. I saw it. She had a decline. She's normally a very energetic person, and a decline in energy and sleeping all the time. No willpower to go out and do anything. Next thing you know, when I hit the door, here's the kids. Can you fix dinner now? And those things are okay with me, but what I noticed is she lost an interest in cooking. You know, she loves cooking. And I thought, what's going on? And so that slow decline, consistent decline in her energy was a key for me recognizing that there was a major problem.
Okay. So then let's get to a little bit about treatments. And we spoke about surgeries and radiations, and then obviously treatment with sandostatin LAR. You want to walk us through a little bit around the surgeries and the radiations and then eventually sandostatin?
Well, once we got the original diagnosis, I ended up with a right hemicolectomy, removing that portion of my colon along with the tumor. After that, finding that there was spread into my lymph node system, which caused the doctors to investigate to see if there was further distant spread, which there was, into my liver. And we ended up with the CyberKnife high-dose radiation treatment, hoping that would shrink my tumors, but it didn't shrink it to the point where we were able to abate being able to do the surgery. So surgery still ended up having to be a part of my process because the tumors were both softball and baseball size. They were pretty good size, and they didn't shrink significantly enough to where we weren't able to do it. So still needed to do the liver resection. And then after that, left because there is metastasis into other parts of the body that they're not able to significantly remove or treat. I was still left with some residual symptoms. So at that point, the doctors introduced sandostatin as part of my regimen of care to give me back some control over how I was able to live day to day.
Can we just take a quick pause?
Okay.
How far do you want to go with sandostatin before I go in? So if you could tell us a little bit more around treatment and while you're on sandostatin and your visits to the physician.
Okay. I've been on sandostatin for going close to 4 years now, and I found it easier. In the beginning, we talked about doing the daily injections at home. Didn't feel comfortable with that. So the doctor introduced me to the LAR, which really did do a lot for helping me being able to function day to day. And the fact that I only had to go in once a month for the injection was appealable to me, since I didn't feel comfortable with keeping myself on a regulated schedule to make sure I got my doses exactly at 8 hours every day. So that appealed to me with the long-term injections. I like going into the doctor's office because I am able to get one nurse in the office that gets comfortable with giving me the medication, and she knows I'm coming. I usually call on my way out. She'll get the medicine out, get everything mixed and ready for me. So after I've seen the doctor, they've run my blood work to check and see where all my numbers are, you know, and that way we can gauge if we're at the right dose level for me. If we need to make some adjustments from what happened from where I was the previous month, that gives us an opportunity to have that conversation. But with the monthly doses, it has helped me to regain many of my life functions day to day prior to diagnosis or even getting ill.
Okay. So this is a question for Emerson. Dealing with a neuroendocrine tumor like carcinoid, how overwhelming it must be, obviously, for the patient, but for the family and caretakers as well. So if you could tell us a little bit about the role that you've played as the spouse and the primary caretaker,
Sure.
That would be helpful.
Where I thought it was important for me to come into the picture was giving her a background of knowledge about her disease and helping her when she was not able to do the research on her own or not able to really focus and listen, pay attention to what the doctors were telling her. I was that second set of ears that would be able to collect the information, go back, do the research, and then when it's a better time for her to have that discussion about possibilities, options, how we would proceed, and what some of those side effects might be that she may have heard or may not have heard at the doctor's office. And then to organizing the kids, making sure their routine was good, bringing in family support, just providing a safe haven for her to get better. That was my job, and I took it seriously. Things that I didn't know about, I found out about, and I was able to communicate with her about how those things affected her on a daily basis. She'd tell me her symptoms. I'd find out about what possible things that we could do to alleviate those problems. And all she needed to focus on was getting better. And so I ran the support role that way and took it seriously.
I'm just going to come up with a couple of things. So one, just to follow up on what you were saying, maybe some of the resources, you know, or advice that you would have perhaps for someone in your situation.
So that was my next question. So this is a hard, so we might want to tease this out a bit, but I think it's hard but an important question, that if you were talking to other patients, because the end result is what advice could you give them, this as specific as you can get? And there's the family, you know, but specific resources, specific family, extended family, but knowing that not everyone may have the computer knowledge you did to do the research, things like that. So, so the question.
Yeah, but I think in general terms, I mean, what I'm hearing that you've done really well is to be informed, to do that research, to advocate for yourself. So I think some, you know, just I think you know the message that we want to give is to empower people. And I mean, that's what I'm hearing.
Yes,
from your story,
very
is
much
just
so.
really a story of strength.
Right. I guess for me, because of course you've never heard the word carcinoid before, knowing what I was dealing with, what I was up against, what were my options. So I had to know about the illness. I didn't want to just fold and give up. I had babies to live for. I was 38 years old. I had a lot of life ahead of me, just was not ready to give up. So education, education, education. I had to know what the illness was. You know, you think cancer, most people hear cancer and they think there is a time limit on their life. So I did spend a lot of research going, how long do I have to live? Am I going to be here for my babies when they graduate high school? And the more I found was how well of care you received determined what the quality of life you had, and making sure we got the best. You know, my husband and I at that point were working for the same company. We worked for a great company, great insurance. I'm like, okay, we've never used it before now. We're going to get our money's worth. So we were able to make ourselves available to get the best care possible. And that was very, very important for us. My initial diagnosis came from a doctor. He was a great doctor. He was one doctor, small practice. Was humble enough to admit he didn't know much about carcinoid and actually referred us to Dr. Anthony, who was at that point all we had ever heard as far as leading research in our part of the country for carcinoid. Went there, came back with some great information, but realized we needed a bigger practice with more resources. Nutrition, wasn't quite sure how I needed to eat. Wellness care, because emotionally it is a lot to digest.
Sorry.
It's okay.
No, I just had a cough. And
Okay.
I apologize. Sorry.
No problem. So, wellness counseling. Okay. And also, as far as trying to weight management, my weight was fluctuating all over everywhere. Wasn't quite sure where I should be with that, and what other supportive medications I could take to continue to help me to get better. So we made a decision to switch to a very large practice in the state of Georgia where we live at that had all of those resources available for us. And in the process, we also got connected with a hospital that has a really good cancer treatment program. So between our practice and the hospital's cancer program, we were able to get the care that we needed. But we did have to fuel that change. We did have to ask the questions. We did have to do the research to know what questions to ask. So when we got to the point where we felt comfortable enough to make a good decision on where we wanted to get our my residual care, we were able to make that move.
What I did was, when I realized how rare this cancer was, I told my employer, I got him involved. I said, I need your help because we're dealing with a rare form of cancer that there's not many answers to. In fact, there's no cure for. And that helped them to realize that what state of mind I was in and where my family was. And so they got right behind me and gave me the support I really needed. That was awesome, and it really gave me room to work within. Now I had not just dealing with cancer, but I'm dealing with research. I'm dealing with finding limited resources that are out there to help my wife get better. And they understood better. So that is something I would encourage anyone to do. Specifically, call it carcinoid or NET. Give it a definition to where you're going to get more resources than you would just using the word cancer. And that was an education for us too, wouldn't you say? Mm-hmm. Defining it differently and helping us to go forward.
Nice. Go ahead.
So it's just, I don't remember your exact code, but it was something that you said in the earlier session that I know really connected with the audience. Mm-hmm. You were talking about, I think through one of the websites, the whole when you hear hoof,
right.
Maybe talking a little bit about that from
sure.
a physician perspective.
Yes.
And the hoofs think of zebra, the hoofs think of the horse.
Right, that was amazing. When I read those things on the NET Cancer Awareness Day website, it connected with me because our doctor initially, our oncologist, he wasn't making the connection between cancer and carcinoid. And so he didn't really know what to do. Our next doctor heard of it, but now what I know is I would suggest to a new carcinoid patient is to tell their doctor that this is something rare and they really need their support. But even more than that, they need to be educated about their disease and help the doctor help them educate themselves. Resources is the key. Finding out what this is all about, reading, understanding, knowing which drugs are going to help them through their, difficult periods. That made the difference in quality of life for her.
For me, education took away the fear. knowing what I was dealing with, knowing where I was in the stream of dealing with my illness, looking at carcinoid cancer as a chronic illness versus a death sentence.
Right.
And you know, it takes a while to get to that point. Okay, I have an illness, this is like diabetes or some other major illness that a person can never get a cure for, but it can be managed and you can live. So it took a while for me to get to that point. But the educating myself made the big difference to say, hey, I can live with this, I can do this. I just need to find what route to take that's going to work for me and it's going to work for my family. So that's going to be an answer that's going to be different for everyone depending on their circumstances and their resources. Do they have the insurance that's going to be able to help them pay? What outreach programs are they able to make themselves available for? I actually have a friend of mine who doesn't have carcinoid, but she has acromegalia. And her insurance refused to pay for sandostatin. So she was actually able to reach out to Novartis, and they have her on the nurse program. They come in once a month and administer the medicine to her at no cost. And so that was a huge benefit to her family. And they had insurance, but for whatever reason, they deemed it an experimental drug or whatever the case they used, whatever excuse they used, but they didn't pay for it. So, you know, being able to know that there's other resources out there, a lot of times people don't know that the pharmaceutical companies have those options for them, and they feel like I don't have any insurance, and they just give up.
Give up. Yeah.
And so, you know, being able to help people to see what avenues they have, that there are options and that they don't have to give up.
I'd say the main thing with carcinoid is probably when you hear the word cancer, it frightens so many people to the point of where they give up and they lose hope. But that's not the case all the time with carcinoid. There is life, there is opportunity. It could be managed depending on where it is. But don't give up. Don't shut down. Look for a solution. Look for opportunities to make yourself better, because it's possible that you could live with it for a while.
Yeah.
Did you find it easy to, you talk a lot about education, and I'm just wondering, did you find it easy to educate yourselves? Did you find the resources out there? Like, what was that process like?
I mean, when you turn to the normal resources, American Cancer Society, NIH, you know, you don't get carcinoid. You don't get carcinoid. You get breast cancer, colon cancer, you get carcinoma. You don't get carcinoid, so you don't fit. So that's when there's a disconnect between the mainstream information about cancer and carcinoid. We were able to get to carcinoid.org and other organizations that focus primarily on carcinoid, and that's where we found our main education. But it's not the initial layer of information out there. You've got to dig down 2 or 3 levels before you can get to that point where you get the information about carcinoid. When you don't know what to expect, you don't know what you're dealing with, it's hard. But when you realize people have been living with this illness, managing this illness through proper care, and been able to have good quality of life for years, it takes a lot of the fear away, and you go, okay, I can do this. Other people are doing this. I'm not by myself. I can do this too. So it takes a while to get to that, though.
And here's what I found. I did a lot of research. The doctor told us the initial diagnosis was colon cancer. And so I started researching colon cancer. And, you know, I found the sarcomas and the carcinomas. But then that's not the information that I needed. What I really needed was carcinoid colon cancer. And when I researched carcinoid colon cancer, I found a whole different world of information and resources. So again, I emphasize that word carcinoid makes all the difference in the world and an outcome for the patient, because the medicines are different, the application of medicine, diagnoses are different. All these things are different than regular, as they say, cancer. And so that had to take place. My knowledge now was carcinoid first, cancer next.
I have one request that's completely different, so whenever are you...
Yeah, from a real support, depending on how we would use this, real support, patient testimony. I'm not quite sure how. Do you think we've touched on?
I think we got the mental and the physical.
Okay. So how do I start? Who do I?
So you might
Yeah.
say something like,
If I had one thing to say to you.
Okay.
right, that would
Okay.
be perfect.
Gotcha. Okay.
We have completely, I'm sure, like tired you out, and you're like,
I'm trying to make sure my stomach doesn't growl. We ate breakfast early. Just run out.
We'll go right now.
Okay. Okay.
Sorry.
No, you're fine. I'm just going. I hope I don't make noises. So.
You guys ready?
Yeah,
Okay.
This, you would say directly to the lens.
Yeah.
Okay.
Okay.
Gotcha.
Who's going, it's one at a time. Who's
She's
going?
gonna go
No,
first.
let him go first.
All right, I'll go
Okay.
first.
Go ahead.
1 second. And I'd like to hear Emerson, thank you, and action.
If I had one thing to say about sandostatin, it would be that you have the ability to help people live better lives through the administration of this drug. That made the difference for us. Use it. Get that drug out there.
Thank you.
If I had to say one thing as a patient taking the sandostatin medication is emphasize to the doctors how important it is to adjust the medication based on the patient's needs, not stick to a by-the-book protocol as to what works for the patient. Encourage the doctors to give the medication as they need based on what the patient is telling them. Ask the patient how they are feeling on a day-to-day basis, how they feel throughout the month, to make sure the patient is given the highest quality of life possible. So don't be afraid to push back to the doctors in the medical community about stepping outside the box of the normal protocol for the medicine.
I don't think we're going to be able to use that.
Okay,
Only
okay.
because our
Gotcha.
reps can only stay to the
Okay.
indicated label, and I'd be afraid that our
Oh,
internal
gotcha.
review team would say,
Yeah.
one of the reps
Okay.
educated this. I'm
Gotcha.
sorry.
No problem.
I-
Okay.
I mean,
But
and-
you know what I'm dealing with, right?
Yeah.
Every month we're playing
I
and pushing
know.
and
I
so,
know,
okay.
I know, and we're
Yeah.
trying to support that, but we can't do that for the
Okay,
reps.
gotcha.
Perhaps, if I could suggest just kind of taking yours in a
Okay.
little bit of a different direction.
Okay.
Where I thought you were going to go was just,
Let me get my words together in my head. Okay, all right. If I had one thing to say to you as you are out meeting your doctors and talking about the sandostatin medication is let the doctors know that carcinoma may be an option of them looking at as to what the patients are going through, the symptoms that they're dealing with, and promote the drug as a sound way of giving patients relief from their symptoms, managing their day-to-day lives, and knowing that there's an option out there for them. Over-the-counter medications are not going to do this. A good, sound prescription drug is going to help. So,
it's wonderful.
okay.
Okay.
I'm sorry.
No, that was
Okay,
perfect. Like,
okay.
That was,
Okay.
Perfect.
You were
Okay.
like, you had our lawyer.
Been on them for
Yeah,
a short
yes,
period.
very much so.
This is Emerson's deal. This is not her
No,
deal.
not at all. He's the comedian.
We're Sando strong.
Yeah, okay.
Yeah.
Our family's Sando strong. Okay.
Okay.
Maybe as you repeat it several times, you hammer the
Okay.
Okay.
camera.
Okay.
Play with it a little bit.
All right.
Ham it up. Ham it up.
Okay.
You want to say we're the Cunninghams and we're Sandostrong?
That's cute.
Okay.
All
Okay.
right.
Go ahead.
Okay, stand by. Excuse me. Camera roll. Okay. Ready? And action.
We're the Cunninghams and we're Sandostrong. You got to say it with me.
Oh, I'm sorry. I'm sorry. I thought I'm just window dressing. Okay. All right. Okay, we'll do it again. Okay.
And action.
We're the Cunninghams and we're Sandostrong.
Is that good?
Again.
Okay. Okay. Okay, you got to do your arm up like I do.
Okay, great.
All right. All right. Okay.
Why don't you start it off?
Okay. We are the Cunningham. Oh, I'm sorry.
Okay. And with pride in that fact.
Okay.
And action.
We're the Cunninghams, and we are
Sandostrong.
And now to that camera.
Okay. All right.
And anytime.
Okay. You go.
We're the Cunninghams and we're Sandostrong.
Okay.
Let me get the hands in the shot this time.
Okay.
Do a little closer to if you can.
All right.
Okay. All right.
And
Okay.
action.
We're the Cunninghams, and we're Sando Strong.
Okay, then one time with her doing it.
Okay. Hi, we're the Cunninghams, and we are
Sando Strong.
Okay, we can't possibly abuse your kindness.